All right, let's talk about blood donation. We always hear about it when there's a big emergency, right? But what if I told you the real story? The most important reason people need to donate has nothing to do with those huge disasters we see on TV. It's actually about this quiet, constant need that keeps our entire healthcare system running every single day.
And that's what most of us think, isn't it? That blood is just for those big, dramatic events. A huge accident, a natural disaster. But honestly, that's probably one of the biggest myths out there. The truth is, well, it's a lot more every day, and in a way, a lot more urgent.
Yeah, that's the key takeaway right there. The big disasters get all the attention, but the real non-stop need for blood, that's happening day in and day out in hospitals everywhere. And that need, it doesn't clock out for the weekend or wait for an emergency to show up. So that brings us to what you could call the everyday emergency. It's this constant puzzle that hospitals are trying to solve. See, they can't just store blood on a shelf forever. It's not like that. It's a living thing and it has a very real expiration date. And this is where it really hits you just how urgent this is. Take a look at this. Platelets, they're absolutely critical for things like cancer treatments, and they only last for about a week, 7 days. Red blood cells get you a little more time, around 42 days. So you see, this is nothing like stocking up on canned food. It is a constant, nonstop race against the clock. It has to have a steady stream of new donations. And that quote just says it all, doesn't it? We can invent all sorts of amazing medicines and high-tech gadgets, but we absolutely can't create human blood in a lab. There's just no substitute. So the whole system, every single transfusion, every person who's saved, it all comes down to one thing: people willing to step up and give. So when people donate consistently, they create this reliable stream that keeps the hospital blood banks ready for anything. It means a doctor doesn't have to think twice before an emergency surgery. It means cancer treatments can go ahead as scheduled. You never have to worry, will we have what we need? It's that simple. Regular donors, they're literally the bedrock of modern medicine. Okay, so we've talked about the how and the why for the system, but let's get personal. Let's talk about the who. Who are the actual people whose lives are changed or even saved by this one simple act? And wow, the list it's just about everyone. We're talking about someone in a bad car wreck rushed to the ER, or a patient going in for a major surgery. It's for cancer patients whose chemotherapy just decimates their blood cells. And then you have folks with chronic disorders like sickle cell disease, new moms with really serious complications during childbirth, and even tiny, fragile newborns in intensive care. A single donation, your donation, reaches into pretty much every part of a hospital. And get this, here's a number that just makes it all so real. One donation doesn't just help one person. See, when you donate, your blood is separated into its different parts: the red cells, platelets, and plasma. And each of those can go to a different patient. So your one donation can end up saving or helping up to 3 different lives. Think about that. 3 lives for about an hour of your time. That's an amazing impact. And this is a really crucial point to get. For some people, say someone with a condition like sickle cell disease, getting a blood transfusion isn't a one-time emergency thing. For them, it's a routine treatment. It's a lifelong therapy, just as vital as any pill they have to take. It's that constant supply from regular donors that lets them live a normal life. Okay, so obviously donating blood is an amazing thing to do for others. But what if I told you there's something in it for you, too? Turns out there are some pretty surprising health perks that come along with being a regular donor. Before you even donate, they give you this little mini health check. They take your blood pressure, check your pulse, and test your hemoglobin levels. If you donate regularly, it's basically like getting a free wellness screening every couple of months. It's a great way to keep tabs on your own health and maybe spot something early, like high blood pressure or if your iron is low. Now, this part is really cool. A lot of people, especially guys and women after menopause, can build up a little too much iron in their bodies. And as you can see here, all that extra iron isn't great. It can cause stress on your system and make your heart work harder. Well, guess what? Donating blood helps bring those iron levels back into a healthy balance. Some research even suggests it might lower your risk of a heart attack and help your circulation. How about that? All right, let's pull back and look at the big picture. We've seen how it helps individuals, and we've seen the neat benefits for the donor. But what happens when a whole community of people commits to donating regularly? Well, you become way more than just a donor. You become a vital part of the entire public health system. And I really like this idea of a safety net, because that's exactly what regular donors create. When you have a solid base of people giving regularly, the entire healthcare system becomes stronger, more resilient. It's ready for anything, whether it's a huge highway pileup or just a week with a lot of surgeries. There's no panic, no shortages. It creates this incredible stability that benefits all of us. And really, that's what it all comes down to. And I'm not exaggerating here. This whole massive, complicated, life-saving machine we call healthcare, it's literally held up by these unsung heroes, these regular people who quietly take an hour out of their day to make sure the system always has what it needs. That is a huge, huge contribution to the well-being of your whole town, your whole community. So there you have it. The system runs on people. The need never stops. And the impact? It's just massive. It saves lives, it helps families stay whole, and it makes our entire community stronger and safer. So I guess there's really only one question left. Will you be a lifeline?